I'm Dr. Max Gomez. This month we explore men's health. Everything from why we don't like to go see the doctor, to the latest treatments for prostate and testicular cancer, to how marriage affects your heart. Science and You starts now.
I'm Magalie Laguerre-Wilkinson. Gentlemen, we know that you have to be pushed and dragged to that doctor's appointment. But now there's a new health center just for men, coming up on Science and You.
I'm Dr. Max Gomez. It's the most common cancer diagnosed in men, but doctors are actually over-treating it. How new imaging and genetic testing is changing prostate cancer treatment. Ahead on Science and You.
I'm Mike Gilliam for Science and You. Testicular cancer affects thousands of men, but it doesn't have to be a death sentence. Medical professionals have made great strides in treatment. We're going to tell you all about it and what you can do to protect yourself ahead on Science and You.
I'm Tinabeth Pina. Is it a real problem for men or just media hype? The truth behind low testosterone, coming up on Science and You.
I'm Anne Riddell. Love can break your heart, but could it also keep you healthy? We'll tell you about fascinating research on marriage and cardiovascular disease, what it means for all of us, and men in particular. That's ahead on Science and You.
I'm Magalie Laguerre-Wilkinson. Urology, dermatology, internal medicine, even plastic surgery, guys. And it's all for you right here in Midtown Manhattan. This Madison Avenue office tower is home to a trending new curve in men's health. The NYU Langone Medical Center is dedicated to providing men with specialized treatment for their special male needs. The challenge, though, is getting guys to make that all-important first appointment. Dr. Norman Sussman is staff psychiatrist here at the Center for Men's Health. Why are men so reluctant to go to the doctor?
It's hard to explain fully, but we know that women, as a matter of course, routinely see their OBGYN and are more likely to go see a doctor if they don't feel well. Men, first of all, don't have that need to see an OBGYN, so they don't go to their urologist routinely. But there are many men who actually are afraid to go to the doctor. If I ask people, why don't you go? And they'll say, I'm afraid of doctors. Now,
in a place like this, again, a men's health center, does this make it easier for men to see a physician, to come to a place that's specifically geared towards men?
People do feel better being able to share some of their problems with men, because you have to realize a lot of men come in with issues related to things they might be ashamed about. Mm-hmm. They may feel that being anxious or being depressed, which they don't recognize as depression, but they just feel unmotivated, they're having problems at work. They really don't want to talk about it.
Getting men to relax and reveal their health concerns is the medical mission of the Men's Center.
We've created an environment that men feel very safe. Mm-hmm. They feel safe that we're not judgmental. We kind of really understand the philosophy of men. We understand that men don't respond well to criticism.
As the center's medical director, Dr. Stephen Lamb is especially attuned to a male perspective on health care.
The tragedy for men is that most young men will graduate from their pediatrician when they're, let's say, 17, 18, and will probably not see another doctor until they're 50. Whereas women continue to be treated because they get pregnant, they have to see the gynecologist. So there's no gap. There's no medical gap for women. For men, there's a huge gap.
Great efforts were taken to make the medical center as personal and as all-inclusive as possible.
Chest x-rays, abdominal sonograms, pulmonary function studies.
Everything.
Sleep studies, vascular studies. Yeah, outpatient sleep studies. Huh. So we do essentially everything. I can walk over to the cardiologist and say, what do you think about this EKG? What do you think about this sonogram? What do you think about this story? Mm-hmm, mm-hmm. And the cardiologist can come to us and say, look, thanks for letting me see the patient with heart disease, but their real problem is their obesity.
The idea that a patient can literally walk down the hall to consult with any number of medical specialists is appealing to men and meets an important need. Dr. Sussman sums it up best.
This is a one-stop mall. for men's health care.
So, gentlemen, don't put off those doctor's visits anymore. Make that appointment for your sake and that of your families. I'm Magalie Laguerre-Wilkinson for Science and You.
I'm Dr. Max Gomez. Prostate cancer strikes nearly 250,000 men every year in this country, but the vast majority of those cases are slow-growing, non-lethal cancers, and treating those can lead to often unnecessary and unpleasant side effects. But now researchers are starting to figure out how to tell the really bad cancers from the ones that can just be watched.
He noticed over a period of time that it was increasing slightly here. Say,
Your PSA.
PSA was increasing, right?
That's the scenario hundreds of thousands of men face every year. Their PSA, which stands for prostate-specific antigen, is going up. But despite its name, PSA is a blood test that isn't all that specific for prostate cancer.
You can have an elevated PSA and not have cancer, and a low PSA and have cancer.
So like most men in his situation, Gilbert Horn decided to have a prostate biopsy. The results did show cancer, but
It is a low score. It's a very slow growing type of cancer.
which all sounds like good news unless you understand how prostate biopsies are done. A dozen needles take tiny slivers of tissue from the prostate at random. The problem is that a prostate gland often harbors multiple small cancers.
There's a significant cancer in one area and our needle misses it. There's all these tiny insignificant cancers and our needle hits it. What we really want to happen is where that significant cancer is, our needle goes right through it, and now we can really assess the risk of that cancer.
Until recently, there was no good way to aim the biopsy needles at areas in the prostate that were the most likely to actually be a lethal cancer, as opposed to the indolent, relatively harmless ones that make up the vast majority of prostate tumors. But the prostate team at NYU Langone has pioneered a new technique that uses a special MRI scan to identify the most suspicious areas in the prostate. Then computer software fuses that image with a 3D ultrasound of the prostate so that the biopsy needles now target and sample those potentially deadly areas. When Dr. Lepore did that type of targeted biopsy on Mr. Horn, the results were very different.
We weren't dealing with this sort of insignificant disease, but one that we certainly felt over his lifetime would certainly and likely become a lethal problem.
Those results changed Mr. Horn's mind about active surveillance of what had been thought to be a relatively harmless cancer.
Much more concerned, so the decision was to go with a surgical, the prostatectomy.
Those targeted biopsies mean that a pathologist can look at the most suspicious cells under the microscope and give it a grade called the Gleason score. Trouble is,
some cancers which under the microscope look very innocent, Gleason 6 cancers, some of them, a small percentage, maybe 10%, have a biological profile that's much more aggressive. And we know those tumors are the ones that need to be treated.
And vice versa. Some cancers that look aggressive under the microscope turn out to be fairly innocent. How to tell the difference? Dr. Peter Scardino, chairman of surgery at Memorial Sloan Kettering Cancer Center, says by looking at the genetics of the tumor itself. Myriad Genetics, the same company that developed the BRCA gene tests for breast cancer, has come up with a test for prostate cancer that analyzes 46 genes to generate a molecular fingerprint of a prostate cancer.
Somewhere around 20–30% of the patients who seem to have a more aggressive tumor actually have a more favorable result when measured by this biological test.
And a number of large clinical studies of this Prolaris test have shown that in a significant number of cases, tumors that looked relatively innocuous were likely aggressive and needed more treatment.
It doesn't require a new biopsy. It doesn't even require a blood sample. It can be done on the biopsy you've already had.
While these advances have helped doctors identify which prostate tumors really need treatment, the treatments themselves have not changed all that much. So Dr. Lepore is developing a laser technique to destroy just the aggressive tumors within a prostate, while Dr. Scardino says the genetic testing will help identify drug targets for less invasive treatments. all of which will help avoid the most feared side effects of even the most successful prostate treatments, and that's impotence and incontinence. For Science and You, I'm Dr. Max Gomez.
I'm Mike Gilliam for Science and You. Surviving testicular cancer is a lot easier today than it was years ago, but you have to know what to look out for. We came to New York Presbyterian Columbia University Medical Center to learn more. Dr. James McKiernan is a professor and chairman of the urology department at New York Presbyterian Columbia University and an expert when it comes to testicular cancer. It's a disease that usually strikes young men between the ages of 15 and 30.
Testicular cancer is cancer that affects exclusively men, and we also refer to it as germ cell cancer because it's a tumor that affects the cells that are designed to be part of the reproductive tract in men, specifically the cells that give rise to sperm in the testicle.
So what causes it?
We don't know exactly what causes testicular cancer, but one of the known risk factors is something called cryptorchidism, or undescended testicle. About 1% to 2% of male children are born with one or both testicles that have not actually moved down into the scrotal sac, and those children tend to be at higher risk of testicular cancer later on in life. Beyond that, a large number of patients who get testicular cancer do not have that condition, and we don't fully understand why they get testicular cancer, whether it's an environmental exposure, a genetic predisposition, and there have even been some wild theories about things like cell phone usage or exposure to high tension wires, but none of that's really been proven to be associated with testicular cancer.
What are the symptoms? How would a person know that they might be getting into a danger zone?
Most often when a patient comes in to see us at the hospital, they say, I felt something on my testicle and it doesn't quite feel right. A lot of patients will come in and not have noticed anything, and it's either noticed by their sexual partner or it's noticed on a routine exam by a doctor. And then another group of patients will actually present with widespread spread throughout their body, or metastatic testicular cancer, and that can cause symptoms such as coughing or back pain or weight loss, far more ominous and concerning symptoms, and that's usually a sign that the detection of the disease has been at a very late state.
Testicular cancer is relatively uncommon. Dr. McKiernan says each year in the United States, roughly 7,000 men are diagnosed with it, compared to 230 to 240,000 cases of prostate cancer. And he says great progress has been made in treating the disease. In the 1970s, the mortality rate was about 50%. He says it's now down to between 2 and 4%. A lot of the decline is due to research and awareness. Much of that has been due to publicity surrounding Tour de France cyclist Lance Armstrong and his very public battle with the disease that began in 1996 and ended with him cured a little over a year later.
He was diagnosed with quite an advanced case of testicular cancer, and he presented actually with coughing and coughed up blood after riding his bicycle. And they detected that he had testicular cancer, which had already spread to his lungs. So a very advanced stage testicular cancer, and was essentially completely cured by a combination of surgery, chemotherapy, and radiation, and went on to win 6 Tour de France races after all that treatment. So if there's a poster child for a success story, Lance Armstrong is it for sure. And testicular cancer can have a great outcome even when detected at a very advanced stage.
Dr. McKiernan says testicular cancer is not a death sentence. And even though they remove the diseased testicle, most patients go on to live normal lives after they're cured.
Most men retain the ability to have sexual function, and most men retain fertility. So the function of the testicle in a normal situation is to produce testosterone, which is a male hormone, and to produce sperm cells, both of which are critical to fertility and male sexual function. And the use of just one testicle is usually adequate to provide fertility and normal hormonal function to most men.
In fact, Lance Armstrong would later father a child after undergoing chemotherapy for testicular cancer. Dr. McKiernan says the message is check yourself out, and if you think something is wrong, see a doctor. Don't wait.
It's highly treatable. Don't be afraid of it. Don't be afraid to call the doctor if there's something slightly abnormal about the testicle. The checkup is easy. There's absolutely no side effects or toxicity to going in and getting checked. And if they find something early, the treatment could be quite a bit less burdensome to you than if it gets detected late.
They can survive?
Absolutely. Survival is the theme, and it's almost always achievable.
We can't emphasize enough how important early detection is. While doctors say testicular cancer is almost always curable, they like to catch it early so they can minimize the stress on the body. I'm Mike Gilliam for Science and You.
I'm Tinabeth Pina. Low T. It's something we're hearing more and more about in media ads. But is it true? Is it real? And is it something men should be concerned about?
Now with a lot of the awareness of, quote, the testosterone issue, it's another reason that men go to the doctor. It then behooves the medical profession to evaluate them properly.
Testosterone is a hormone. It's basically what puts hair on a man's chest and the driving force behind his sex drive. It's what makes a man physically. With an aging male population and more openness about discussing sexual issues with their doctors, a diagnosis of low testosterone is becoming more common. And so have those ads promising great things.
So you can be more like the guy you used to be, with over 700,000 bottles shipped. Ageless Male is the smart choice to support your free testosterone levels.
But can a prescription for low testosterone literally be an anti-aging cure-all?
It is not a cure-all, and that shows there are people that don't respond to it, don't need it. If it doesn't take care of their problem, we're upfront about it, and we tell them, look, this is not your problem. And this isn't going to make you 20 years old. And this isn't going to make you a giant at the gym. We're going to get you back to your normal level, to your safe level.
According to a report from the Mayo Clinic, testosterone levels gradually decline throughout adulthood. In fact, once a man turns 30, his levels decline about 1% a year on average.
In men who have a significant drop in their testosterone, what these men will often complain about is a decrease in libido. It also may translate in a decreasing erections. They may have increased fatigue. They may have increased body fat. Their workouts in the gym may not be as powerful. The effects of their workouts may not be as great. They may have a little irritability, but many of those are very non-specific. They also may have a drop in bone density, which is important. Just as you hear about osteoporosis in women and fractures, well, men get that as well. That's a very important role for testosterone.
But doctors are quick to point out that while it may well be low T, sometimes these symptoms can be something completely unrelated to hormones.
And this drug isn't for everybody. And that's why you really need to monitor everything very carefully, evaluate them carefully, and treat them carefully. And a lot of people are worried that people are being treated for no reason. Well, I don't believe that. I think most of them really do need it. And that's why the number of prescriptions are going up, because they're responding to it. Their symptoms are getting better.
Where you were like at 30 years old is different than 40. So this is just it's a very subtle, consistent way to get things to where they were. This is a very healthy, this is not a risk that I'm taking. I look at it, I'm enhancing, an already healthy lifestyle.
There can be side effects, however. Testosterone therapy can cause blood clots, acne, and in younger men, limit sperm production. Plus, the effects of long-term use have yet to be established.
I'm a grown man, it's my body, and I have no problem coming here. I'm not hesitant whatsoever about getting my injections once a week, and it makes me feel a lot better in a lot of different areas. And to me, I think, like I said before, this is natural. It's not synthetic chemicals they're giving me. It's naturally produce hormones that my body just isn't making as much anymore on its own. So,
normal testosterone levels range from 300 to 1,000 nanograms per deciliter.
There's no one level that's right for everybody. What we do is make sure that we don't go beyond the normal range, the physiologic normal range that's set by the labs. We don't go beyond that here. When they get normal, they feel better. It has been abused by so many people for so many of the wrong reasons that it has still a bad reputation, although less now. It can be a transformative medicine if used as a medicine.
Testosterone replacement therapy is only appropriate and safe for men who have below normal levels of testosterone and who don't have any medical conditions that would be made worse by taking testosterone, such as an enlarged prostate gland or evidence of prostate cancer. For Science and You, I'm Tinabeth Pina.
I'm Anne Riddell. Love can be heartbreaking, but could it also keep you healthy? Research shows married people are less likely to have cardiovascular problems. So why is that, and what does it mean for the men in our lives? Love and marriage, they are said to go hand in hand, and there might just be a cardiovascular benefit as well. A recent large-scale study by researchers at NYU Langone Medical Center shows that being married can affect the risk of heart disease.
Our study demonstrated that marital status is important for your health. It found that if you are married, you have a lower prevalence of having vascular disease. What was really interesting was that we found that it didn't matter what type of vascular disease, whether you look at your heart arteries or your lower extremity arteries or your arteries in your legs, aneurysms inside your abdomen or your belly, or your carotid arteries, arteries in your neck. It really didn't matter. Being married was associated with a lower risk.
Cardiologist Dr. Jeffrey Berger explains it's impossible at this point to say exactly why, but marriage clearly seems to have its benefits.
I definitely think there are things that a spouse can do, whether it's encouraging you to see your doctor every year, whether it's encouraging you to take medicines that you're already on. These are small things that are really difficult to quantify that actually make a very big deal.
And that brings us to men. Is there a specific benefit for them, given that we often think of men as more reluctant patients than women and less likely to seek medical care? Dr. Carlos Alvear, a cardiology fellow and also a researcher in the study, says in his case, marriage makes a difference.
And you're married yourself, you said, right?
I am happily married, yes.
Do you think that it's protecting your heart?
Oh, absolutely. My wife is also making sure I eat the right thing, I exercise, so I see the doctor. So I think is a key part of it.
So do you think all this sort of reaffirms that women nagging their husbands is in fact very good for them?
I think that says that it's an effective way to keep patients on track.
And as I explained to the doctors, I've done my own unscientific research on this topic.
For my birthday this year, I asked my husband, the one thing I wanted was for him to get his physical. That's how it goes in our house.
And did he?
He did.
There you go.
But let's not get ahead of ourselves, ladies. Our health is also potentially improved by marriage.
I think people normally tend to think that men need that marriage. They need that sort of, relationship to sort of help their health. Clearly that was true. But I think what's really interesting is that we found that also for women, that our data was not only showing that men did better if they were married, we found the same benefit if you were a man as well as if you were a woman.
This diagram details some of the specific findings of the study, which included more than 3.5 million adults. It compares married people to those who are single, divorced, or widowed. For married people, the rate of coronary artery disease, the most common type of heart disease, was 6.3% compared to about 7.5% for unmarried people. Cerebrovascular disease, which affects the circulation of blood to the brain, affected 8.8% of married people and 10.8% of those not married. And take a look at the rates of peripheral artery disease. That's a narrowing or blockage of the vessels that carry blood from the heart to the legs. Among married people, the rate was 5.7% compared to more than 8% among unmarried people.
When you're in a relationship, you have someone who is watching your back. You have someone who will sort of give you that little added push.
So, gentlemen, the next time your wife badgers you to see a doctor or stop ignoring those aches and pains, listen more closely. She might just be telling you she loves you, and it could be good for your health. I'm Anne Riddell for Science and You.
That's our show for today. I'm Dr. Max Gomez. See you next month on Science and You.